Trikafta, a pharmacological intervention for cystic fibrosis. Trikafta is a medication that is prescribed in chronic treatment of cystic fibrosis in patients that are 2 years and older who carry at least one F5-8del mutation. Trikafta is a fixed combination dose medication that combines elexacaftor, tezacaftor, and ivacaftor. Elexacaftor is a CFTR corrector that modulates CFTR proteins into facilitating trafficking to the cell surface, incorporating into the cell membrane. Tezacaftor also functions as a corrector to facilitate folding and improve presentation of the mature CFTR protein into the cell surface, improving the function for CF8del mutation. The combination of elexacaftor and tezacaftor results in an increased number of mature CFTR proteins presented at the cell surface, therefore improving ion transport and symptoms of cystic fibrosis. Ivacaftor is a CFTR potentiator that binds to the mutant CTFR protein presented at the cell surface to markedly increase transport of ions, including chlorine ions. The combination in Trikafta increases the quality and function of the F50del mutation in the CFTR at the cell surface, resulting in the increase of CFTR activity as measured by the CFTR-mediated chlorine transporters. It is important to assess for any drug-to-drug interaction when starting and stopping medications for patients that are on CTFR modulators or when transitioning to a different one. Elexacaftor, Trikafta, and ivacaftor are substrands of acetylchrome P450, an enzyme CYP3A. When exposed to strong or moderate inhibitors of CYP3A, such as aerosol antifungal, it can increase the exposure of elexacaftor and tezacaftor, while inducers of PY3A, such as rapamine, can decrease the serum levels. It is important to know that food and herb products can also affect the CYP3A. Foods containing grapefruit can inhibit the CYP3A in the gastrointestinal tract system, while herbs such as St. John's worts induce the CYP3A. Routine monitoring and laboratory testing in transaminase is important prior to commencing Trikafta, every 3 months during the first year and annually afterwards. Patients who develop elevated levels of aminotransase should be monitored more frequently, and doses should be interrupted if symptoms of jaundice appear. Aminotransase levels rise above 5 times the ULN. With taking precautions before restarting and making sure they fall into the normal range, as this can be an indicator for liver injury, liver disease, or vascular disorders.